All right, so the main focus of today is periorbital rejuvenation. So we're going to talk all about the aging eye and what treatment options that we have. The goal today is we're going to be looking at the anatomy of the eye and how aging changes the structure and the skin and really everything around the eye, common concerns or things that people come to the office that see us for, all of the non-surgical treatment options that we offer, and what to expect and next steps. Before we go into any of this, I want to just introduce myself because many of you are new patients or maybe we haven't met before, but my name's Dr. K. I'm a board certified dermatologist. I did my training at Penn State in Hershey, Pennsylvania. If anyone's ever been to Hershey, it's a very cute town. And then after my residency, I wanted more training in laser, aesthetics, and injectables. So I did a full year out in California as a fellow and worked at a very large cosmetic practice in San Diego. I do regular dermatology, cosmetic dermatology. I love lasers, injectables. I do a lot of hair loss as well as vein treatments, as well as many other things that we offer in our practice. In addition to clinical medicine, I have a strong passion for research. I love doing research. It's always so exciting, like being able to answer new questions and studying new things that we're doing. So I've been involved with about 20 cosmetic clinical trials. I am involved with a lot of textbook chapters and writing of research articles and have done many lectures. So let's focus on, I call it periorbital, but all that means is around the eye. So the skin around the eye, the structure around it. And I put these photos here not for us to really deep dive into it, but just to emphasize that it's super complicated. So the eye is one of the most complicated structures on the face, and there's so much anatomy that goes into it. So when you're trusting someone to do any treatments near your eye, you want to make sure they know the anatomy really well, have studied the anatomy, because it's not as simple as it might seem. Now, what is going on around the skin around the eye? Now, it is the thinnest skin in our entire body by a significant amount. So it's only about 0.5 millimeters thick. That is 1/20th of a centimeter. So if you kind of think 1/20th of a centimeter, that is almost like a sheet of paper. It's super, super thin, whereas the remaining skin on the rest of our face is about 2 millimeters thick. So it's about a quarter of that. There are some oil glands, but not a ton. So the eyes, especially the under eye areas, are very prone to dryness. So people that are prone to eczema, rashes, sensitive skin may get redness and scaling around the eye area. The skin around the eyes is the thinnest, it's the most vascular, and we are blinking 10,000 times a day. So that causes repetitive movements in that area that can lead to tiny little lines that can form around the sides of the eyes and underneath the eyes. This is due to loss of collagen, loss of elastin that can lead to fine lines, crepiness, and then sun damage is starting to become more cumulative, and we start to notice it around the age of 40. Now, it's not just skin. There are other different layers underneath the skin. There's also muscle and there's bone, and they're just as important as the skin. So there's a muscle right underneath here that starts to weaken with time. The fat pad underneath it might start to herniate out. You might start to see bags or puffiness underneath the eye. The bone, the socket supporting our eye, starts off as a nice rectangle, but over time, it starts to change into a more teardrop appearance. So people may start to notice a line here like a teardrop. And then we have the volume loss. So the fat pads that are supporting the eye start to decrease with time. And that can make things look a little bit more sunken in. It makes it look flat and feels like our eyes are moving more back into our head, into our socket. And vascular. So little blood vessels will form underneath the eyes. And since the skin is so thin, you can start to see that, and that can also lead to fluid retention. So when I was preparing for this talk, I was really focusing on what do people ask for? Like, what is the reason why people are coming in? And I would say the first thing on this list is what I see the most. I feel tired when I'm well rested. What I feel on the inside is not matching what I'm seeing on the outside. And that could be from dark circles or hollowing, deep wrinkles when you smile, brown spots around the eyes. One eye looks smaller than the other, or both eyes are smaller than what they used to be. When you smile, does one eye get smaller compared to the other side? Under eye puffiness, an eyebrow droop. So the eye doesn't exist in a vacuum, right? We're not just treating here. We have to look at the big picture. That's what makes the most natural uniform results. So we're looking at the big picture. The eyebrows are a huge part of that. So we're also looking at the shape. Is it too low, too high, and making adjustments from there. Now, I really wanted to highlight on some of the technology that we have here, because the eyes, it's usually never just one thing, and it's always fun to look at your skin in different ways to fully understand why we're recommending certain things and what you can expect. So when you come to our office, not only are we taking photos, but we're also looking at 3D imaging. So this is a 3D image based on photos that were made. And this person comes in for under eye evaluation. She feels tired. She wants tear trough filler. So we don't just jump right into filler, right? We need to evaluate and make sure we understand what changes are happening. So what's the first step? Well, the first step is looking at what we call the gray view. So this is a view that kind of looks like a Roman clay statue of some sort, but what it does is it takes away the skin and we just look at volume, we look at shadows, curves. Are there any areas that we can support underneath? So even though we're looking right at the eye area, you can see that there is a little bit of hollowing right underneath the eye. So that's one area that we're looking at, but also not just there, the temples, the cheeks, this line that comes from the corners of your nose, the corner of your mouth, your nasolabial fold. So I love looking at the gray view because we want to make sure when we're doing a treatment or recommending a treatment, there's a reason why. And then we also, of course, I'm a dermatologist, I'm biased, I love the skin. I always want to do something to help the skin look better and have better skin quality. So that could be addressing hydration, addressing redness, and addressing brown. So that's what these photos are doing. So you can see the redness scale. This is a polarized view of redness because we can address that with the laser, as well as hyperpigmentation, which is like brown spots, brown patches, dark circles, or even sun damage. And then we don't end there. The last view that we like to look at, which I would say maybe one of the most important, I may have said that for all of them, are the symmetry views. So the symmetry gives us a very objective way of looking at asymmetry. Now, we all have asymmetry. No one is 100% symmetrical. But when we're doing treatments, our goal is we want to help the symmetry. We don't want to make any asymmetries more noticeable. So if you look at the photo in the very center of it where it says baseline, that is our baseline 3D image. And then we can put the two left sides of the face together. And then we can also put the two right sides of the face together. So why are we even doing this? Well, when we're doing certain treatments, we want to account for, is one eye bigger than the other? Is one eyebrow higher than the other? So we can look at that and evaluate, or is one cheek wider than the other? The two sides of the face develop on their own independently and then combine when we are, growing as cells inside our mother's stomachs. So they're never going to be 100% symmetrical, but certain treatments we can do to help with that. So what are our treatment options? There are so many options that we have. I tried to break it up into like 3 bigger categories, and we'll go through all of them. So first, relaxing wrinkles and folds. So these are done with something called neuromodulators, and then lasers to help tighten, to help the skin, and then skincare. I like to always tell patients, I'm just one small aspect of this. What you're doing at home, especially sunscreen and other skincare products, are just as important as what we're doing in the office. So I want to make sure you're on a really good routine. What is a neuromodulator? So the most common brand name that people know is Botox, but actually we have 5 of them here. So we're not tailored to just one specific brand, and we evaluate your anatomy and the location that we're treating based on which product that we use. So we have many different options based on what you've tried before and what your goals are. How do they work? They work by relaxing the muscles. So they're not completely freezing them, but we are trying to relax them. So certain expressions cannot make the skin fold in that same repetitive movement, which leads to wrinkles over time. It's very quick treatments, about 15, 20 minutes. It takes actually longer for us to discuss, to do our full evaluation before, doing the actual treatment itself. Results start around day 3, day 7, and can last anywhere from 3 months, but there is one that's a little bit longer. There's really no downtime except maybe possibility of some bruising that may or may not happen, and the goal is always natural looking results. I have soften here in bold because our goal is to soften the crow's feet. When you smile, having a little bit of crow's feet can actually be very endearing, can warm a smile up. So our goal is to not completely remove that because we don't want to, change the way you see yourself when you smile in the mirror. And we can say so many different words, but I think photos are so much better about what can you expect from different treatments. So this is one of our beautiful patients. She was bothered by some wrinkles around the eyes. And just with a few units, we were able to completely soften the lines in that area. She still has a little bit of lines, but that's okay. Our goal is for things to look natural and still look like yourself, just a little bit more rested. This is another example. So this is a much younger patient. Now, we didn't just treat her crow's feet. I also treated the area in between her eyebrows, and I also treated her forehead lines. In addition to that, I did a full face laser to help with overall skin quality and skin complexion. So you can see before, her eye got a lot smaller when she smiled and kind of scrunched up at the sides. And by just doing a little bit, a few units on the side, we were able to completely soften that. And it's not just the sides, the lines here. People call them crow's feet. I don't like that word. I think that's like a horrible way to describe them, but those are some areas that we treat. Now, in addition, we can help with some skin bunching or muscle bunching that can happen underneath the eyes. Some people call these jelly rolls. Once again, I just do not like that terminology, so I won't use it. But if you've heard the term jelly roll, this is what we're treating for. And just with a couple of units, we're able to soften that bunching that can happen with the smile. And her eyes look so much more open and awake when she smiles. This is another patient. We treated just a little bit on the side of her eyebrow and her crow's feet. And you can see her eyes are much more open, and kind of the vector of her face, it's shifting more up rather than down. And that is just by helping to support the eyebrows a little bit because she was bothered by hooding and didn't want to do any surgical procedures. Okay, now shifting gears to more volume support. So because we're losing bone, we're losing fat, we need something that will help provide some more structure underneath the skin to help bring back what we were losing. So there are a couple different ways we do this. There are injectable fillers like hyaluronic acid. We have a ton of them. We have a ton of different options. So hyaluronic acid fillers are just a very wide category, but we probably have at least 20 different kinds that we pick from. And then Sculptra is another option that I will do commonly in the cheek area to help tighten and thicken the skin. And that will indirectly help with lower eyelid skin without even having to do anything in lower eyelid. Now, the most important thing before doing these treatments is the consultation evaluation, because we want to make sure, are you a good candidate for this? And by doing these treatments, are we addressing the concerns that brought you in? Because sometimes shadowing, we might think, oh, we just need to add filler there, but actually it could be more hyperpigmentation. So that's why we have all this technology and different products to really make sure we're addressing and diagnosing the problem first and foremost, the most important thing, so our treatment matches what we're trying to treat. I had mentioned that I really love doing research and really involved with different things. So this was a paper that I wrote with some of my colleagues here, and I just want to highlight some things that we did. So in these treatment options, the treating physician, Dr. Fabi, so she treated Sculptra in the cheek, so nothing in the under eye area. And you can see by just providing collagen back to the cheeks, it improves the under eye region without having to do anything there. So Sculptra is an injectable that helps support collagen products. There's also been some evidence to help it can help with stem cell regeneration in that area. But that could be a great option for people that are looking for really natural results, that just want their skin to be a little bit thicker, a little bit more tightened, but don't want to do anything right underneath their eyes. And then moving on to lasers. So I would say this is where like my heart is. I love lasers for the eye area because we have so many different options based on what your goals are, how much downtime you have, and what your personality is. Are you more of someone who's like, I want a one and done? Or are you someone who wants something a little bit slower with more treatments over time? So I highlighted just 3 lasers here, but we have so many other different options, so this is not a fully inclusive list. But first and foremost, if we're starting with like the most gentle laser, that would be our Clear and Brilliant laser. Now, I say gentle, but it still provides amazing results, and we'll highlight a few of those there. Now, this I would say you'll need anywhere from 4 to 5 over a year. We don't have to do a month to month, but usually I tell people do 3 1 month apart, and then maybe take a little 2 to 3 month break, do your 4th, and then another 2 to 3 month break and do your 5th. This laser is also safe to get closer to the eyelid area, so it's great for hyperpigmentation as well as helping to stimulate collagen in that area. One of the projects that I was involved in that I recently presented at a conference in Paris was just by showing 2 Clear and Brilliant laser treatments with a good skincare routine, specifically vitamin C, we were able to show that we can reduce certain biomarkers of aging. So even though this is saying gentle resurfacing, the results are still there. And then we have biopsies and biomarkers that have really shown that it can really help reverse some aging signs. In our moderate category, I put the Fraxel laser. The Fraxel has 2 little settings that we can go through. We can go and do collagen remodeling setting that can help thicken the skin, help with fine lines, as well as sun damage and hyperpigmentation settings. So it really can help address 2 different categories, and it's not just limited to the eyes. Commonly we'll do the full face, but if the eyes are the only areas you want to treat, we can also do the eyelids. In order for me to also do the upper eyelids and get all the way to the lower eyelids, I do have to put eye shields in, which if you come in for evaluation, we will discuss more in detail and make sure that the Fraxel is a great option for you. The Fraxel has also been shown to help reduce the risk of skin cancer by nearly 50%. So it's not only helping with fine lines and pigmentation and wrinkles, there's also a skin health component to it because we're exfoliating those precancerous or sun damaged cells. And lastly, CO2 laser. So we have about 3 different ablative lasers in this office. And what that means is basically it is heating that top layer of skin. So then your body responds by tightening. And with that heat that is provided, it produces more collagen in that area. This is a little bit more on the more advanced side of laser resurfacing. But with that, usually we just plan for 1 treatment session. You may need to repeat it in 5 years or so, but really that depends on, are we doing other things in the meantime? Are you good with your skincare at home? So it can very much vary. So all these different options, let's go through some photos together. So this is an example of the Clear and Brilliant laser. So this was a full face laser treatment. We did 2 treatments in addition to 2 medical grade topical vitamin C. And this was one of the patients that were included in that study that I had mentioned. Now, I didn't want to just focus right on the eyes because the eyes, even though we're talking about the eyes, it's a full face. We have to take everything into consideration. So even with just 2 laser treatments, you can see how much we were able to lift that sun damage and pigmentation. This is another example. So usually we're doing different treatment modalities. So this was a patient of mine that her goal was she just wanted to look a little bit more refreshed. So we did 1 treatment sessions with some neuromodulators to help relax the muscles before we did a laser treatment. And we did the Fraxel to the full face for her. So you can see that her skin looks a little bit more refreshed. The brown spots have been lifted. Some of the lines and crepiness underneath the eyes have completely disappeared. These are some arrows just highlighting some of the under eye structures. And then lastly, CO2. So with a one-time treatment, there is some downtime with this. So if you're thinking about a CO2 laser, definitely come and see us so I can talk you through all the downtime as well as what to expect afterwards. But it is probably, I would say, the gold standard for wanting under eye crepiness, wrinkles and folds, eye laxity, and it works really well. So this was an example patient of she wanted CO2 done for eye wrinkles and crepey skin with some wonderful results, as you can see in the under eye area. This is another example of hyperpigmentation. So this patient had genetic hyperpigmentation, meaning it was just the way her skin was. Some of us, me included, are prone to hyperpigmentation underneath the eye. And this is highlighting that clear and brilliant laser again, as well as a paper that we recently published with colleagues showing that it's effective in all skin types and safe in all skin types. It can really help lift the pigmentation in that area. And it's not always just pigment. There's blue veins that can develop underneath the eye, as well as redness that can happen. So if redness or blue veins are a concern, there are other lasers that we have for that. So each laser has a specific goal, a specific task. So commonly we'll do a couple throughout the treatment. We'll mix and match, and depending on what your goals are, that helps me pick which laser is a good option for you. So we have one laser that targets the blue veins, one that helps with the redness. So let's go through a couple of examples. So this was a patient who came in for wanting tear trough filler. But after looking at all the images, the 3D imaging, we discussed, well, actually the shadowing that you're seeing is not from a volume concern. There's actually redness and there is a blue vein developing underneath it. So after 2 treatments for the blue vein, and this is just 1 treatment for redness, you can see that the under eye shadowing has significantly improved. Here's another example of another patient. You can see that there are 2 fairly large blue veins underneath her eyes, and after 2 treatment sessions, they're gone. Now, it's not a fully encompassing list, so we have tons of other different options too. So I couldn't go through every single thing because it can be a lot really overwhelming, but other options, radio frequency microneedling. So this is microneedling where the ends of them are heated, so that extra heat can help with collagen production, tightening the skin laxity. It also can help with crepiness as well as festoons, which are little areas of swelling that can develop underneath the eye. We'll commonly combine it with PRP as well, platelet-rich growth factors, which are drawn from your blood. We take your blood, we spin it down, and then those growth factors we can drop on top to help overall with wound healing as well. And then there's other lasers that we have for maybe some stubborn growths that can happen around the eyes. So there are growths like xanthelasma, which are little yellow deposits of cholesterol that can develop underneath the eyes, or syringomas, which are enlarged glands that can develop. And last but not least, skincare. So skincare, there are so many different options. Even me as a dermatologist, I get overwhelmed by skincare products. So our goal is to really simplify it and make sure that you know what to look for in a product, because there are so many different options. So we're very picky on what we offer. So we only offer 4 different types of eye creams, and they all have different functions. And I wanted to put the key ingredients to look for, because this is really what it comes down to. What is inside the product and what does it do? So I make sure it aligns with the goals that I want. So retinoids, those help stimulate cell turnover. They help with collagen production. Peptides help with signaling skin repair and firmness. Vitamin C, one of the best ones, in addition to retinols, is an antioxidant, so it protects you from the sun, helps with hyperpigmentation, as well as skin brightening. Hyaluronic acid helps with hydration. Growth factors and SPF are also super important as well. So these are some of the 4 types listed here. I wanted to give a little tip, because one common thing that I hear patients tell me is, I tried a retinol, a retinoid, or tretinoin, or some sort of prescription. My skin couldn't tolerate it. And I hear that almost every single day. And so there have been a few tips that I have kind of learned and developed to try to build your skin tolerance to be able to use a retinoid every day or even every other day. So one tip is that retinols that are inside eye creams are formulated for thin and sensitive skin, because the skin around our eyes is so sensitive. So when people are making eye cream products, they are studying it around the eyes to make sure it does well there. So one thing you could think about doing is actually doing an eye retinol to the full face, because it's formulated for sensitive skin. And then once you finish that, slowly working your way up to another slightly stronger retinol. I like the Skin Better Alpha Ret. This is an over-the-counter retinol, but works just as well as a prescription without the irritation as well. And I love retinols because it helps so much with tightening the skin, help with collagen production, fine lines. Milia are very common around the eyes, and retinoids are a nice way to help exfoliate, to help prevent Milia as well. So one of you guys will be super lucky and be able to get my favorite product. So it's really important to really think about it's a combined approach. So the step one, most important part is to assess. We figure out what your goals are and making sure that what we can do can help align with those goals. Two is coming up with our treatment plan. It's usually not a single one and done. We're on this journey together and making sure that as things are changing and developing, we're helping the aging process happen more gracefully. Resurfacing, so that's with laser treatments where we're helping the texture, the tone, and help tighten. And lastly, maintaining. So extending the results, extending what you're doing at home so you get the best impact. So what are the next steps? I do want to talk a little bit about our practice and what makes us unique. So, we have a 360-degree approach to aging. So we don't just do one thing. So we do injectables, we do laser treatments. We have an amazing aesthetics team downstairs as well as estheticians that help with facials as well as Milia extractions. And our goal is that it's never just one thing, because if we want everything to look natural and aging gracefully, it's usually just small little bits of multiple different things because they all address different layers of the skin on how they're aging. We were recently nominated this year for a Center of Excellence, so that's in the top 7% of physicians nationwide, and there are only very few dermatology practices that have this recognition. And then I've already talked about our areas of focus. So if you were to move forward with a consultation, we would go through all those imagings, the gray view, the polarized view, symmetry views, talk about your goals. And the point of a consultation is education. So we provide you all the handouts, a customized treatment plan, and then you can decide, is it something that you align with and you want to move forward with? And if anything, if you learn something new, then we're happy and our job is done. So I keep plenty of time for questions. So let me get out of here so we can discuss them. So some of these we have talked a little bit about. So how long do you need to stay out of the sun after the Fraxel laser? So this is a really great question. So when you're doing laser treatments, you don't want a lot of sun exposure because that may impede the results we're trying to get. So it may depend on the person. I always say at least 4 weeks before and 4 weeks after. But as a dermatologist, I'm pretty biased. And probably what I will say is, well, you don't need to go out in the sun. Sunscreen, wearing hats. So I would say 1 month before, 1 month after. I wouldn't go to like the Caribbean or Puerto Rico. But following that, of course, having a skincare regimen that has sunscreen incorporated. So if you are going to be out in the sun, you are protecting it. Another thing about sunscreen is tinted sunscreens provide a little bit more protection for those that are prone to pigmentation or melasma. So if you do have any of those two conditions, then transitioning to a skincare that has tint in it can actually be more beneficial. And then which eye product should you use for overall eye skincare? So it's not as simple. There's retinoids, there's ones that help with puffiness, that can help with brightening, as well as one that can help with hydration. So if you want a combination of all of them, then maybe using one in the morning, one at night. I always like to start with just one eye cream at a time because we don't want to overload our eye skin products initially. So we start with one product. Likely what I would recommend is the retinoid to start with, and then slowly we would incorporate a second one in the morning based on what you need. If that's more hydration, if that's for puffiness, or if we need more brightness, then that would dictate which one I recommend. How long does CO2 treatment last? So this is so variable. It can depend on your age, your genetics, how much sun exposure you have, as well as, what are we doing in between? If we're only doing a CO2 and nothing else, then you might not get it as prolonged as what you want. I would say maybe 5-10 years results, but if anything, it gives us a nice reset so you don't need to do as aggressive treatments further on, and we can maintain it with little small products. What products are best for rosacea? I've had laser treatments in the past. So rosacea, totally different ball game, but for anyone who doesn't know what rosacea is, basically it is this skin condition that can lead to some background redness on the cheeks, the nose, the chin. It can lead to redness as well as little bumps that can come up. And there's no cure for rosacea, but we have a lot of options that can help. Specifically, a V-beam laser that I did talk a little bit about. That laser is like one of our workhorses here. We do it every single day, multiple times a day, and it just addresses redness. So it's very targeted, very specific, and it does a really good job of helping with rosacea as well. And then in terms of like products, of course, sunscreen to make sure you're maintaining the results. And then we have a moisturizer called the Sente Dermal Repair that's approved by the National Rosacea Society that I recommend my patients to use that are coming in for laser treatments for rosacea. Where on your face should you and not use Retin-A? So this is a great question. Retin-A, for anyone who's not aware, is just the brand name of tretinoin, which is a prescription retinol therapy. So it works for collagen production, anti-aging. It's also approved for acne as well. So this can depend on your skin type and how your skin can tolerate it. When I tell people not to use it, I don't like doing it in the folds of the skin because it can really exacerbate its impact. So corners of your nose you want to avoid. And the eyelid skin is really sensitive. So one person might be able to do it close to the eyelids, one person can't. Just my personal experience, I cannot use it around my eyelids or I get very dry, very rashy, it burns and kind of defeats the whole purpose of trying to do a skincare product. So that's why I like to use a retinol that's formulated for the eye skin. Can you send out the information slides without patient photos and their information? So we will be recording, this is all recorded and it's going to be uploaded to our YouTube channel. So if you ever want to go back or you're like, what did Dr. K say about that laser or things like that, it will all be there for you, all that information. And then we'll also be sending some follow-up emails as well, just to, give you a rundown of what we talked about and any other additional information. And a lot of this stuff is on our website. So if you guys haven't checked out our website, we did a total new revamp. Everything looks really good. And we have a section that talks about different concerns as well as a section talking about the laser treatment. So if there might have been something that you missed or you want to read more about, I highly recommend sending you guys to our website. You can see even more photos of other patients that we've treated. Great. Okay, and then Retin-A and rosacea. So does Retin-A affect rosacea? I would say yes and no. Yes, if your skin is dry, red, and irritated from the Retin-A, then it's going to make the rosacea look worse because you're going to be more red and more rashy. So the biggest thing with rosacea is you don't want to flare the redness. You want to make sure you're using products that are very sensitive and good for the skin that are not going to exacerbate redness. If you don't have any irritation from it, then there's no reason not to use it. Wonderful. Well, I hope this was helpful for you all. I know it can be a little overwhelming if you're hearing these things for the first time. Just know that everything is going to be recorded. It's on the website if you want to come back to it. The eyes are a very complicated structure. So you want to make sure that whatever treatments are being done, fully understand what's being done, why we're doing it, things like that, because it's not one single treatment that usually makes or break it. It's like small different combinations of different things. And then last question, is there something you would recommend for dermatitis around the eyes? That's tough. I probably wouldn't be able to answer that question without a little bit more information. Dermatitis, it just is like a rash around the eyes, and there are so many different reasons why. It could be an allergy, it could be a product, it could be a fragrance, an irritant. It could be something you're spraying on your body or something you're putting in your hair. So we need just a little bit more information to help decide what would be a good treatment. Great. Awesome. Well, if anyone has any other questions, please let me know. And it was really awesome to meet you all. Thanks so much for your patience during our little technology difficulties. Usually that doesn't happen, but I'm really grateful for you all for, sticking around while we were trying to fix that. Awesome. Everyone enjoy the rest of your day and your lunch, and we'll talk soon.